At MedsPLUS Consulting Pharmacy and Wellness Center, you're not just a number. We offer individualized care for each of our patients, plus prescription delivery and medication management.
Bringing the pharmacist back to the community, MedsPLUS Consulting Pharmacy and Wellness Center. Hello, MedsPLUS family. This is Dr. Jennifer, your community pharmacist, and I'm here today with your weekly dose of health information. Now, I haven't been here in a while. I've recently celebrated a birthday and traveled with family, but I am happy to be back with you today and to talk about this month's health awareness. July is Mental Health Awareness Month, and this year's theme is Strength in Communities. This month is dedicated to shining a light on the unique mental health challenges faced by Black, Indigenous, and people of color. Because the truth is, mental health does not look the same for everyone. And for our communities, the barriers run deep. But also so does the strength. Today, we're going to talk about what mental health really looks like for us, not the textbook version, our version, the real conversations and real solutions. And that starts right here in the community. How many of us grew up hearing what happens in this house stays in this house? Or how many of us were taught to pray it away, to push through, to be strong, to keep going no matter what? How many of us are carrying grief, trauma, anxiety, and exhaustion and calling it tired? We were taught that strength meant not breaking down. But I want to offer a different definition of strength. Strength is knowing when you need help. Strength is asking for it. Strength is refusing to carry alone what was never meant to be carried alone by one person. Black and brown communities have survived generations of trauma, systemic racism, economic inequality, health disparities, loss, grief. We have been strong for a very long time, and that strength is beautiful, but strength without support is just suffering in silence. And our communities deserve better than that. So why don't we get help? Let's be honest about it. The first barrier is stigma. In many of our communities, mental health struggles are seen as weakness, as being crazy, or something to be ashamed of. And that stigma keeps people suffering in silence for years, sometimes decades. Another barrier is culture. We were raised to be strong, to handle it, not to air our business, to keep it moving. And while that resilience has carried us through so much, it has also kept us from getting the help we need. The third barrier is access. Finding a therapist who looks like you, who understands you, who knows your experience, who gets your culture, is not always easy. There is a shortage of Black and brown mental health providers, but I do have some I can recommend in the city of Birmingham. These are therapists that have either referred patients to us, or we met, or we work with some of their patients. So the reason that's important is because when you can't see yourself in the person across the table, it can sometimes be harder to open up. And we want to be able to help you solve that barrier of access. The fourth barrier is cost. Therapy is expensive. Not everyone has insurance that covers mental health. Not everyone can afford to pay out of pocket. And some people go without year after year. These barriers are real. But knowing the barriers is the first step so we can work through them. How does your pharmacist fit in? More than you may think. As your pharmacist, I am accessible. You may see me more often or talk to me more often than your primary care physician. That puts us in a unique position to be part of your mental wellness journey. If you are currently taking medication for depression, anxiety, or any other mental health condition, your pharmacist is your partner. We make sure your medications are working. We ask questions, watch for side effects, check for interactions. We answer questions you might have that you may be too embarrassed to ask someone else about. And if you are struggling but don't know where to start, you can start with us. So, what do I mean by that? We can be a resource. We're not therapists, but we can be a resource to help you navigate in an area that you may not have navigated before. It's a confident, judgmental free zone. You don't have to have it all figured out before you come through the door or call us on the phone. This month's theme is strength in communities, not strength in spite of community, not strength despite our circumstances, strength in community, because healing does not happen in isolation. One way to guarantee unhappiness is to isolate yourself from other people. We want to work on the opposite side of that. It happens when we show up for one another. It happens when we normalize the conversation, when we stop whispering about mental health and start talking about it at the dinner table, barbershop, beauty salon, church, our families. And Lady Wu on V94.9 always says, you need your therapist and your pastor. So we can work hand in hand with that. In our families, we need to check on our people, not just the ones who look like they're struggling, but the ones who look fine, the strong ones, the ones who are always taking care of everybody else. Check on them too and ask the real questions, not just how are you, but how are you really? Are you sleeping? Are you eating? Is there anything you need? And when someone is brave enough to tell you the truth, listen without judgment, without offering solutions, without minimizing, just listen. This is strength in community. This is how we heal together. I want to leave you with this. You are not weak because you are struggling. You are not crazy because you need help. You are not a burden because you cannot carry it alone. You are human and you deserve care. The same care that you give everybody else. This month, I'm asking you to do 3 things. Number 1, check and listen. Number 2, if you're struggling, tell someone, your doctor or your pharmacist, a trusted friend. Number 3, come see us or call us at MedsPLUS and let us help you navigate with finding the right therapist for you. Review your medications and become your wellness partner, because mental health is health. And in this community, we do not leave each other behind. There are many licensed professional counselors, therapists, psychologists in the Birmingham community, and they look like us. Just to name a few, Tiffany Story, Story House Counseling. She has been a guest on MedsPLUS Medical Minute before. Also, Lady Wu from B94.9. She has her own therapy counseling office, Vital Life Family Counseling. Crystal Mullen Johnson of Strive Counseling Services. Dr. D'Amico French of Michi Mental. Eddie Sharp with Restoring Hopes. Susan Kirkland of Dunn Kirkland Counseling, TC Counseling. And also a free source or resource if you're not sure where to start, or if someone does not have insurance and is having trouble to pay for services. That would be Black Women's Mental Health Institute, and that's bwmhi.org. You can go on their website and you can set up a counseling session for free. There are many other resources, and if you like, I can actually drop those on our page for you to refer someone, or maybe to use for yourself during that time you may feel like you need a little extra help. If you don't already have a therapist, because as we make an appointment for our PCP, our cardiologist, our dermatologist, it should be regular routine to make an appointment with our therapist. I am Dr. Jennifer, your community pharmacist, bridging the gap in healthcare, one community at a time. Family, take care of yourself, and we look forward to seeing you on next Monday. Have a great day.
At MedsPLUS Consulting Pharmacy and Wellness Center, results matter. Empower your health journey with a pharmacy that puts you first. Plus, we offer prescription delivery and medication management.
Bringing the pharmacist back to the community. MedsPLUS Consulting Pharmacy and Wellness Center.